Hey guys, welcome back to my YouTube channel. Thanks for tuning in. So today we're going to be talking about a little concept known as prejuvenation. Pre-rejuvenation. Now it's something that millennials are talking about more and more, and it really just means what can you do in your daily life that can keep you looking young, feeling young, before you get to the plastic surgeon's office. Obviously, plastic surgery is a great concept to me. I love doing what I do. But what can you do ahead of time to stay looking young and maybe, yeah, I know, stay out of my office? So we're going to be talking about the 10 things millennials can do to stay looking young. Number one, sunblock. Now, simple, inexpensive, but it's amazing how many people don't use sunblock. So I would recommend you wear sunblock every day, regardless of your activity levels. Wear at least a 30 SPF, and when you're outside, go up to 50. The reality is the better you protect your skin, the slower it's going to age, and the more likely that your genetics will play out well in terms of how you age. Don't forget to cover the back of your hands. Don't forget to cover the back of your neck, the front of your neck, and your décolleté. Those ways, those are the places you want to make sure you're getting sun exposure. Now, obviously, if you're going to be wearing short sleeve shirts and shorts and things like that, then cover your skin, your sun exposed areas of the body. So that is probably the easiest thing you can do. Number two, increase the amount of vitamin C in your diet. Now, vitamin C is the most important vitamin when it comes to making collagen. So a lot of people don't even think about it. It's water soluble. Anything you take above and beyond what your body needs, you're going to pee out anyway. So 1,000 to 2,000 milligrams a day is what I recommend for my patients, and it's what I use every day. And my skin's beautiful, and I'm almost 50 years old. So I think that a little nutrition for collagen regeneration is in your favor. So go ahead and take your vitamin C. Number three, use fish oil. Now, fish oil is something that I think a lot of people talk about. It's great for cardiac health. It's great for brain health. One of the things that people don't recognize is that use of fish oils is helpful for making beautiful, more hydrated skin. It increases cholesterol content in the skin, and it allows it a little bit more elasticity and softness. So make sure you're taking about 1 to 2 grams of fish oil a day, and that should work great for you to stay looking young. Number four, here's an easy one. Stop smoking. One, it's a disgusting habit, but two, nicotine has a lot of damaging effects on the body, both from the brain, from a cardiovascular standpoint, and actually smoking is known to reduce your vitamin C levels in your body, and that's why smokers are more likely to have healing problems and, frankly, poor collagen aging, and that's why smokers look more wrinkled and have, uglier looking skin than most people. So stop smoking. It'll save you some money, and it'll basically prolong your life, and you'll look good doing it. Number five, decrease simple sugars in your diet. Now, that probably doesn't seem like something you'd probably heard of, but sugars increase glycosylation, and glycosylation is something that ages the cells of your body. So simple sugars increase your risk of glycosylation of your cells, stiffening different kinds of cells and making them more friable and fragile. Of course, increased sugar intake over time increases the rates of obesity, and the rates of obesity going up increases your chances of type 2 diabetes. So keeping your simple sugars down, great thing to do. Complex carbs are much better for you. They're better at keeping your blood sugars more stabilized and reducing things like insulin highs and insulin lows. So avoid the simple sugars. The white flour sugars, the white pastas, things like that. And of course, you can cheat every now and then, just don't make it a habit. Number six, stay active. Just move around. 30 minutes minimum of moving around, exercise, working out, cycling, walking the dog, whatever. It's good for your heart, good for your brain, keeps you young, keeps you fit and trim, and those are things that help you look better. Obviously, don't get too thin. No, as you get older and you see a lot of very slim older patients, they actually look older because they have that gauntness to them. A little bit of volume goes a long way, but don't try to get too skinny. Maintain a decent body weight that's healthy and easy to maintain, and you don't feel like you're suffering too much from self-neglect or starvation. So stay active. sit less. Number 7. Well, I said you wanted to avoid the plastic surgeon's office, but some of these things are things you'll get in a plastic surgeon's office. Number 7 is Botox. Now, Botox, it's a neurotoxin. We use it to reduce wrinkling in active areas around the face. So wrinkling around the eyes and wrinkling between the eyes, especially all of us who are using these digital devices and squinting at the small print. And of course, raising the forehead and getting forehead furrows. Those things can be softened and smoothed. And if you start your Botox a little bit early, let's say you're early to mid-20s, you're more likely to reduce the chances of fixed wrinkling later on in life. That along with some skincare, and we'll talk about that next. Number 8, Retin-A. It's my favorite drug. Retin-A is a vitamin A derivative, and it increases the speed of turnover of your skin cells. And that basically causes the body to slough off the old stuff on top and bring newer stuff from the deep up to the surface. It thickens the skin and it makes it more hardy and less wrinkle prone, and it just looks better. Brown spots get reduced, redness gets reduced long term, and it just makes for better, healthier skin. You get less acne when you're using Retin-A, and so it's a great drug. It's been around for over 40 years. Best bang for buck. Number 9, skin procedures. Now, you don't have to have surgery. By skin procedures, I'm meaning small things. Things like the occasional chemical peel or microneedling, radiofrequency treatments, things like thermage, etc. Small procedures done on a routine basis keep your costs low, stimulate the body to make better collagen and renew itself, and keep you looking youthful and firm, and frankly can slow down the time to needing something bigger like eye lift surgeries or brow lift surgeries or facelifting surgeries. And number 10, get enough good REM sleep. Now, this is probably the one that's going to be hardest to do because in our busy, high-speed, tech-driven lives, sleep's sort of an afterthought for a lot of people. I know it is for me. I'm up probably 12, 1 in the morning, working on things about my practice and my business and social media, so I don't get a lot of sleep, and I think it's something I should be focusing on for my own personal health. REM sleep is the time your body restores itself. It's when the brain gets rid of a lot of junk, like those tau proteins you hear about for Alzheimer's patients, and that's when it cleans itself. So when you're not getting good sleep, you're not sort of emptying the cache, as they say in computer terms, in your brain. Getting good sleep is very, very important because if you get good sleep, your cortisol levels stay low. Cortisol is an aging hormone. It increases gut fat, and gut fat increases chances of secondary problems like cardiovascular disease and diabetes. So getting good sleep can keep you lean and keep you looking good. And of course, when you've got good sleep, your energy levels are better in the next day. You're much more alert, you're more active, you're thinking better, and you're less likely to have other kinds of secondary problems. So make sure you get your sleep. So those are the 10 things millennials can do. Most of that stuff is stuff you can do at home. You don't have to pay anybody to do it. If you just can alter some of your behaviors, you will get a better aging process. So good luck, guys.